You know, we started out the year on a very good trend upwards. Patient quality measures very high. All of our providers, excellent morale and running forward, anxious to see their patients in a day. And then we get kind of blindsided, literally, with a pandemic. And for most of us, we've not been through that kind of challenge before. So literally from the start, it's been really a matter of feeling our way through with guidance from the Iowa Department of Public Health, from Centers for Disease Control, and also our local Clarke County Public Health, our emergency management services. A collaborative effort really was set up with our leadership and those other two branches to literally ferret out what is the most applicable for our patient population. Living in rural Iowa is a lot better than living in New York City, which we all knew anyway. But in spite of that, we geared up knowing, based on some of the analytic data, that we could have a fairly big surge. But just because we're in rural Iowa doesn't mean we're not at high risk. We have Amtrak, we have industry, we have an interstate, and all of those things we discussed as being contingency issues as we move forward with this. And I think one of the positives that's come out of this for us is we have dealt with this. We've dealt with it efficiently, effectively, and safely, even though we didn't know what we were up against. What that does is it primes us for the next time. But this has really provided us with the nidus for putting our heads together collaboratively to move forward with how are we going to address this and keep our patients safe. Well, I think the first thing, and it's very important for our community and our patients to understand that this is really a safe place to come for your routine medical care. And I can't emphasize that enough. Whether it's hypertension, diabetes, congestive heart failure, COPD, those are the ones that are biggest in our community, that when you come into our continuity care clinic to see one of the providers, that it is a safe environment. We screen everybody at the door. If they have any signs of illness, they don't go to the wellness clinic. All of our clinic staff have been tested, and more than once. I myself have been tested 3 times, simply because I want to keep patients and my responsibility to my providers and staff to make sure that I don't have it. But everyone in that clinic has been tested more than once, and the ones who are working are negative. And I would absolutely guarantee that to anybody who had question. Now, we've gotten clearance from Governor Reynolds to be able to move ahead, do our elective procedures, and we're doing quite well with ramping those up. We have podiatry services. We have oncology that is a booming business down here. Our general surgeon, Dr. Conti, going at it. Our ortho with Dr. Kakade did 3 major procedures today, all of which 2 months ago would have been considered elective and would never have been done, but done here safely and with the knowledge that they're going to heal and do well just as they would a year ago if they had the procedure done. Well, one of our newest offerings shortly will be dermatology. We have a dermatology group that's coming out of Des Moines, well-known group, excellent providers, a number of providers who are well established, so they'll be here. We have a pediatric dentist, and that's a very exciting thing for our region, because this is a dentist who will be doing procedures in the operating room for children or those who have mental challenges such as autism, Down syndrome, that need to have dental work done, but it requires general anesthesia. Then they'll be taken to our operating room and operated on like any other patient to get that dental care that they would never be able to get. We're hoping that we can draw from other areas and provide that as a local regional service. We also just purchased a audiology machine for our ENT doctor and actually for us, because we do DOT physicals and we want to plan an outreach to schools to be able to do hearing testing. Really went above and beyond in my thoughts in being able to sterilize and keep our rooms clean. The hospital purchased a machine that we call Trudy. It's actually TRU-D, but we call her Trudy. And she is an ultraviolet machine that when we have had a possible COVID patient in a room, we bring this instrument, this ultraviolet light, which is about 4.5 feet tall. It's not like what you buy at Lowe's, and it's very beneficial. So our environmental service team, which keeps the hospital just spotless anyway, goes in, does special disinfectant, and then we bring Trudy into the room and run that for a prescribed period of time to further sterilize that. We're the only hospital that has that. The thing I want to leave everybody with is that this issue is not over. It's far from over. There are varying opinions about severity, even whether or not this actually exists. The reality is this does exist. There will be periods of time where it tends to surge, and my concern is that as our influenza season comes forward, that we're going to have a combination of things, because the symptoms of influenza are not a lot different than they are from COVID-19. We have, as of July 1, the ability to actually test for COVID-19 rapidly in-house. And so what I envision is that we're going to be able to step up the efficiency and the timeliness of our screening to be able to help with that. So please, as a general concern, somewhere under a warning, but a strong recommendation from somebody who's been doing this for a few years. If you're out in public, wear a face mask. It is important. If you're out in public, socially distance. It is important. And it's going to decrease your chances of getting something that may or may not be a terminal event for you. Know that every day you go out there, you're going to run into approximately 30% of the population that otherwise has no symptoms of COVID that could transmit that to you. Just be safe.